Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. Exciting show lined up. Let's get straight to it. A new type of bandage combines wireless electrical stimulation and biosensors to bring hope to patients with slow-to-heal injuries. Joining us to discuss is Yuanwen Jiang, engineer at University of Pennsylvania, who helped develop the Smart Bandage. Welcome to the show, Yuanwen.
Of course.
So can you explain what chronic wound is and why they're so hard to heal?
Yeah, so obviously for chronic wounds, normally for normal people, right, we feel like we have a cut, it can heal in a couple of days. But for many people, they're suffering from chronic conditions, especially diabetic patients. And because of the high blood glucose level, they're not going to have a rapid metabolism like how our body, like normal people, works. So for these diabetic patients, it's extremely difficult for them to have a wound to heal by itself, especially those on their foot that's constantly under pressure.
Tell us about these smart bandages, and they've been called an engineering marvel. And by what I've read, they certainly are.
Yeah.
Take it away.
So obviously, right, so we all know when we have some wound on the body, we want to put on a bandage. So a bandage has been around for hundreds or not, maybe even thousands of years, right, just to cover ourselves, to protect the skin from the external environment. But it's quite interesting that even with the rapid development of modern day technologies, right, the bandages we are using nowadays in 2025 is probably the same as the one that was used in 1925, because the bandages are just some physical barriers. They don't have any active functions or anything to help us in like telling us the stage of the wound or like accelerating the healing or whatsoever.
What does this look like when you actually put it on the wound? Is it thin? Because we're hearing it's almost like a coat of latex paint, this electrical layer.
Yeah, different layers. So explain the layers, because the fact that you can get all of this, technology and interesting things that are reactive into something that thin is, again, engineering marvel.
Yeah, well, so thanks to, again, right, the parallel efforts of all these semiconductor manufacturings, right, we have this, very advanced manufacturing capabilities of now actually being able to make electronics as thin as a piece of paper and as flexible as it can be. And now we could actually lay out some of the circuitry on top of that and design a more advanced functionalities like putting some biosensor in it, putting some stimulators for the treatment, and you can even use a smartphone to communicate.
So there's supposed to be going to be, I'm guessing, moving ahead, like an app that you can use to monitor this.
Well, obviously, yes, exactly, right. So you want to use it as something, for example, what diabetic patient has been already using continuous glucose monitor, right? So where you can tap your phone and get the current information of your wound, whether it's being healed, whether it's infected, like the risk level of getting infection, so you can have proactive treatment before anything bad that happens.
Wow. So this can actually send the treatment to heal the wound, right? And keep it sealed?
Mm-hmm. Yeah, exactly, right? So besides just being able to monitor the wound, right, what we care more about is how you can make it heal better, right? So in this particular case, we use electrical stimulation to do the job. And apparently, right, skins are not just like dead tissues. They are very active, right, consisting of all kinds of cells moving around. Right? And under the proper guidance of the external electric field, the cells can migrate along the gradient, just like finding their like the path to move around, and that can, with the proper guidance of the direction, right? So you can imagine cells can be pushed to the right place, and also because we're constantly stimulating them, the cells feel more energetic in terms of their activities. So you can actually turn the status of the cell, otherwise maybe like causing inflammation, but in this case, causing the regeneration or regrowth of the skin tissue.
We're going to take a quick break. We'll be right back with more of the Smart Bandage. You are watching American Medicine Today. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine Procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine Procedures, they consistently reflect 98.75% patient satisfaction. 80,000 procedures have been performed exclusively at our location. Nearly half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. Welcome back to American Medicine. Today, we're continuing the discussion on the intriguing smart bandage.
Talk a little bit about what's called hydrogel. I had never heard of this, and I guess it's what's used to seal the wound. And then my next thought was when I was reading this whole article about this, and again, most of it was way over my head, but I thought, so they use this hydrogel, and then how do you take that off?
Yeah.
Because it's like ripping a Band-Aid off, right? But, so explain what it is.
Yeah, that's great questions. So hydrogel is something like our tissue, right? Like skin tissue or like whatever muscle tissue. It's like a dense mass, but with lots of water in it. So the hydrogel can contain up to like 80% of the water in it. And you can hold it. It can be squishy. It can be adhesive, depending on how you design it. And in this particular case, we use a hydrogel as a way of attaching the electronics, which is usually dry, not adhesive, to our skin, right? So you can have the hydrogel to be very adhesive and also at the same time to be electrically active. So you can send signals from the electronics to the body and also read out the signals. And you also mentioned, right? So it seems like, oh yeah, you have a very adhesive material, very sticky to the skin. That's great. But we all know, right, when you're trying to peel off a bandage from your wounded skin, that's going to be pretty terrible. So in this particular case, we introduce a way of changing the adhesion or stickiness of the hydrogel material with the skin. So at the body temperature, it remains extremely sticky, right? It's very important for us to make that bandage to be attached to the wounded skin. But we just need to heat it up a little bit to about 105 degrees so that the hydrogel will completely lose its adhesion and you can just like easily put it off without causing any kind of changes to underlying skin.
When it comes to length of time that this hydrogel, this product would be on the wound, what is that healing process time frame? Are we talking days, weeks?
Forever?
Well, yeah. So for now, we did experiments, obviously not on human yet, right? So we did some animal experiments, and we were able to show that we could accelerate the healing by about shorten the time by about half, right? So we're trying to push it further, right? So obviously we want to maybe accelerate the healing by 10 times faster, but that's also up to how the cells would respond. But we are thinking about, maybe on the orders of days, but we can do the standard of care changing as thanks for our like this kind of easily removable, on-demand removable mechanism.
Now, this is just proof of concept, correct?
Yeah.
Okay.
Which means it's not going to be available for some time yet.
Mass production or anything, yeah.
Yeah, well, so yeah, obviously this is in the research stage because we are trying to troubleshoot all the best sensors we can get and what's the best stimulation protocols. But fortunately, all of our manufacturing processes are already compatible with all the industrial scales. So scaling up is not going to be a problem. It will be more about fine-tuning the parameters of every little details to make sure we can produce the best product possible.
Okay. Is this something that once it's fully developed, is that going to be in stores for the average consumer to buy, or would this be something just located in doctors' offices?
Exactly what my question was going to be. You read my mind, Kimberly.
Well, we're hoping for like this thing can be directly readily available on the consumer markets. It will be similar to things like where you're trying to use electrical stimulation to relieve the pain or like do some electrical massaging of your muscles. So we're hoping to have it available just in the local retailers rather than having to be prescribed by the doctors.
That's incredible technology. Thank you so much, Yuanwen Jiang, for being on the show, engineer at University of Pennsylvania, who helped develop the Smart Bandage. Thanks for joining us.
Yeah, thank you very much.
Well, that's all the time we have for this segment. Make sure you stay tuned. We'll have more after the break. You are watching American Medicine Today.
I'm a physician. I'm a cancer specialist doing radiation oncology, working full-time. I'm a person who really likes to exercise and take care of myself. Health is very, very important to me.
Stephanie's active lifestyle was threatened after an injury to her lower back.
I lifted something very heavy and I herniated a lumbar disc. And I went for 6 years getting various treatments. Finally, I went to Johns Hopkins and I had a laminectomy and a spinal fusion. And I did physical therapy. I got a lot better. And then I exercised. I did everything I wanted. I had pain a little bit above the area where I'd had the spinal fusion. And over several months, I developed some numbness and tingling in my legs, feeling that my legs were actually weak. I felt like I was walking through molasses and I had numbness and tingling. I'm telling you, I couldn't do very much. I was extremely disabled. I was very, very worried. My husband tells me he was worried I was going to end up in a wheelchair. So I had MRIs. And they told me that I had some spinal stenosis at lumbar 3, which is above the area of the fusion.
Desperate to avoid another spinal fusion, Stephanie tried a number of conservative treatments to relieve her pain.
I had the epidural injections, which only worked for a short period of time. I went for physical therapy, which did nothing. Actually, it made me worse. I went to chiropractors, which didn't work. I had acupuncture, which didn't work. I had radiofrequency ablation, which didn't work. I took pain medicine, which was really only a Band-Aid, and it was really not a good answer because it wasn't solving the problem. So my husband brought me a newspaper article talking about minimally invasive spine surgery at the Bonati Institute.
After learning about the Bonati Spine Institute, Stephanie scheduled an in-person evaluation.
So I went there. Everyone was very nice to me. They took a lot of time reviewing it. And they said, yes, at the lumbar 3 level, they thought that they could help me and that it wouldn't be a long recovery time. I might only have a day or two off work. And the postoperative recovery time would be very minimal. So I decided that I was going to do it because I really didn't have many other options. And I thought, gee, the other procedure, it took me 7 weeks to recover from, and I had metal plates and screws, which I absolutely did not want to go through. So this sounded like a really, really good option.
The exclusive Bonati Spine Procedures utilize conscious IV sedation. This keeps the patient comfortable while awake during the procedure in order to communicate with their surgeon the instant the pain that brought them in is eliminated.
I remember actually getting on the operating room table, and then I remember the anesthesiologist being there and them giving me some light anesthesia. So I was sort of in a twilight, kind of asleep, but I could underhear what they were saying. And then I remember Dr. Bonati talking to me, specifically telling me what he was doing. Well, I am now here at the lumbar 3 area. This is what I'm seeing. This is what I'm doing right now. I'm removing the bone from this side of it. I'm going to this side. I'm removing some bone. I'm seeing some scar tissue. I remember him going through that. I felt complete trust. Obviously he was an expert. He developed the procedure. I didn't have any anxiety or any problem with any of the procedure whatsoever.
Like many patients, Stephanie was surprised by how quickly she was able to be up and walking so soon after surgery.
I had the procedure, and then they wanted to get me up right away. And I was thinking, getting me up right away? This is very quick. Putting my legs down and starting to walk, I didn't have any of that feeling of the syrupy feeling that my legs were weak, that I couldn't lift them, no pain, actually no symptoms. It was like a miracle. I had no symptoms whatsoever. I could not believe it. I'd never expected to have a complete relief of all the problems that I've been going through for months, possibly up to 6 months. It was like, I actually called it a miracle, feeling that I had no pain whatsoever. And I just had so many things to look forward to, like a normal life. It was just like doors were opening up. It was a wonderful experience.
Now a decade has passed and Stephanie is still enjoying her active lifestyle, pain-free.
I'm someone who likes to be very, very active. I know from my experience, it gave me a new life. This is 10 years after my surgery. I still have no problem. I think that somebody should definitely consider this. It's not going to interfere with your life. The recovery time is extremely minimal. There was really no pain involved. And who wouldn't rather have something like that than a major operation? And I think it was 100% successful in me.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV. Welcome back to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. Now, a blistering new book tears into the multi-billion-dollar education system and lays out just how to fix it. Joining us to discuss is Priscilla West, education researcher with the Government Accountability Institute and author of The New Face of Woke Education. Welcome to the program, Priscilla.
Thank you for having me.
So, Priscilla, can you explain what this social emotional learning is and what that's really about?
Never heard of that until now.
Really? Not at all. Okay. Well, it's been around for 30 years, but a lot of people haven't heard of it, which is a little bit by design, I think. If you start with the surface level definition, it's about teaching kids soft skills. They call them soft skills in the schools. Empathy, kindness, collaboration, these types of things. More recently, you hear a bit more about resilience, managing emotions, all of these types of areas that seem maybe, that sounds nice.
Yeah,
right?
warm and fuzzy.
Yeah. But if you take it a little bit deeper, so many things, it has been hijacked by activists, and it is being used to advance a globalist worldview. It has been highly politicized. It's all about this oppressor-oppressed narrative, the critical theories. Yes. So that's where all of this is really being injected into our schools.
Oh, they're white privilege. Is that part of it?
Yes.
Well, here's my thing, Priscilla, and it's been in the news quite a bit lately. Maybe not mainstream news, but we tend to watch conservative outlets, and the big takeaway from what's going on with the education system nowadays is that these, especially they're trying to go into college, they have almost non-existent knowledge. They don't know math.
True.
They can hardly write. They don't know anything about science, but they know about feelings and resiliency, as you were saying.
That's right. Well, there's an opportunity cost for everything. So for all of the hours you're sitting in circle time talking about your feelings, you are not learning algebra.
What is circle time, by the way? Because I saw that.
Oh, gosh.
I saw that too. And then that's another new term to me.
Well, and, a lot of the people involved in doing this, I have to say, they are believers in it. And, I don't want to say that every teacher out there doing circle time is doing something nefarious. But when you really take it all the way up to the UN directives on doing this, they are very explicit about circle time needs to be confidential. What happens in the circle, what's said in the circle stays in the circle.
Oh.
Is the classroom Vegas all of a sudden?
They want it to be more authentic, right? So it definitely so when you have activist teachers who are given this framework and these permissions from on high, they have now a legitimate or legitimized, I should say, way to inject all of their ideology.
This is insane. I mean, we teach our kids, right? So they're trying to rewire their brains to adapt to this filth. And as parents, we teach them, if somebody tells you, shh, don't tell your parents, those are the ones you should run and go tell an adult, and mainly your parent.
That's the red flag.
Yes, this is terrible.
Yes. So if you think of SEL as the operating system, SEL being social emotional learning, the very boring sounding acronym that we've never heard of, SEL is the operating system. And then each of the other acronyms, the ones we have heard of, DEI, CRT, the comprehensive sexuality education, all of these different things, those are the apps that are running within this operating system. So it goes as far back, actually, as Common Core. In the Common Core learning standards, yes, these two things were developed in parallel. So in the Common Core learning standards, they were inserted these funny little soft skills words like collaboration or persistence. And these little words that didn't seem like that big of a deal at the time, while we were busy freaking out because we could no longer teach our third graders math, right? While we were all busy focused on this, the standards had these little words in there that opened children up to psychometric tracking analysis of all sorts.
Wow. So tracking apps. So they're actually trying to track their feelings, how they feel about certain situations.
That's right. That's right. There are dedicated SEL software platforms. Many of us who are active in the parental rights movement have been talking about these platforms for a few years. It seems like lots and lots of variety, but they're all doing the same sorts of things, and they are gathering data. And some of them are journaling apps. Some of them have like a daily mood check-in. There are computerized versions of these things now for high schoolers. There are mental health check-ins.
What's the end game here, though? You know what I mean? Because the tinfoil hat person in me behind hearing all of this stuff is kind of like, what are they trying to do? Like with the recent launch of the Blue Origin rocket that's sending probes to Mars. I was listening to reports on that, and they were saying what our institutions of education here in America need to be doing are producing more engineers and more more students need to be studying STEM rather than this circle time confession BS. Like, why? Who's behind it? Who's trying to undermine?
Well, and they will be. They will be studying STEM. I have no doubt that this system that is being created will produce highly skilled workers, because that is in the interest of the very same corporations who are producing this software. However, the SEL component of all of this, it's marketed as empathy, but the end goal is equity.
I don't know how I feel about this topic, and
where are you on the mood scale right now with this information?
I'm on the angry scale right now. But all these teachers as unlicensed therapists talking to our children, telling them to keep secrets from their parents. What a dangerous slope that we're on.
And as dangerous as that is, now imagine these teachers being replaced by software and AI bots chatting with the children about their moods and their feelings and flagging, credentialing, tokenizing their every thought, their family values. We see these risk surveys in every state where children are asked if their parents have guns in the home.
Wow.
These questions exist on statewide children risk behavior surveys, and these are computerized now. So where is that data sitting?
How can this possibly benefit anyone moving further into their life? If you just think about the normal business atmosphere, thoughts and feelings don't factor in to doing your daily activities. They just don't. If you don't feel like it, I'm sorry that you have to do it.
The
it's
real
your
world
job.
has nothing to do with thoughts and feelings.
No.
It's about production.
Correct. Right.
That's the capitalist society we live in.
The parents who do know about this, who are aware, are outraged, but it is very hard to get the word out there. And when you do begin to attempt it, you will be attacked as a Luddite or a prude, or all of the usual. So these are massive corporations. We're talking about the UN and all of the WEF member corporations. It's a very much a David versus Goliath situation, but that's the purpose of the book. Is I really want parents to start seeing sort of a pattern recognition type thing. The book takes you through lots of different curricula and different programs that all embed this social emotional learning data collection.
Yeah,
right.
Sounds
so
socialism.
I mentioned
That's where
communism. One world
studies,
order.
Social media, social emotional learning.
Patty cake in a
socialist
circle.
mayor in Seattle.
Yeah.
Socialist mayor in New York. Yeah.
Yes.
There's a group called CASTLE. It's the Collaborative for Academic, Social, and Emotional Learning. And they've been at this for over 30 years. They invented SEL out of whole cloth in 1994. And they have been working very hard to embed it in everything your child does, inside and outside of school.
Maybe we can shout from the sidelines and possibly this administration will take notice and put the kibosh on it. This is insanity. Thank you so much, Priscilla West, education researcher with the Government Accountability Institute and author of The New Face of Woke Education. Thank you for this earth-shattering, eye-opening look at what's going on in our educational system.
Well, thank you for having me.
Well, that's all the time we have for this episode of American Medicine Today. If you would like to see previous shows, you can download American Medicine Today to your favorite streaming devices. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.